Hospitals are cornerstones of their communities, serving as principal access points to care for the nearly 60 million people, or 20% of Americans, who live in rural areas. Despite their importance, rural hospitals continuously confront a multitude of challenges that threaten their ability to ensure local access to care. Welcome to Advancing Health, a podcast brought to you by the American Hospital Association. I'm Tom Hedderly, senior writer for AHA. Recently, AHA published a rural report titled Challenges Facing Rural Communities and the Roadmap to Ensure Local Access and High-Quality Affordable Care. This podcast series is built around the rural report, meaning it highlights a rural health challenge and shows how the field responds to the call for action. Today's podcast will focus on access and improving population health through artificial intelligence, or AI. We now go to John Supplitt.
I'm John Supplitt, Senior Director of the AHA Center for Rural Health Services, and with me today is Rachelle Schultz, CEO of Winona Health in Minnesota. The system is comprised of a 49-bed hospital with comprehensive long-term and post-acute services, including swing beds, skilled nursing, and an 80-unit assisted living community. Before we begin, let's review the challenge as outlined in our AHA Rural Report. Insufficient access to primary care and other essential services leads to poorer health outcomes. It also increases the likelihood of more costly, higher acuity episodes at the time of treatment. Plus, limited transportation options in rural areas aggravate access challenges, contributing to delayed or foregone medical attention and disease progression. Artificial intelligence, or AI, means many things to many people, but to the consumer, it means access. AI-enabled technology that partners with doctors, nurses, and other clinicians to make better diagnostic and treatment decisions improves access and quality. Rachelle, welcome to our podcast.
Thanks, John. It's really great to be a part of this series on the AHA Rural Report.
And it's great to have you as one of our experts. So tell us, why did you consider AI as a means to improving access, and who were you trying to reach?
Well, Winona Health is located about 2 hours south of the Twin Cities in Minnesota, and we serve a large area of southeast Minnesota and southwest Wisconsin. Our full-time residents in our community are typical of most rural communities, including having challenges of transportation, as you just noted. However, we're also home to 2 colleges, which adds another 10,000 residents during the school year. This AI helps our clinicians identify and diagnose illnesses and injuries and recommend customized treatment plans. And for us, it's based on a combination of the latest evidence-based medical guidelines along with patient-unique medical characteristics. And initially, as we got into this, our thoughts were that AI would be rapidly adopted by the college students. But our experience has been different than that.
Really? In what way has it been different?
Well, our focus has also been with AI on low acuity primary care. So we expected that these busy college students who are digitally savvy would quickly adopt AI as a means of access to primary care for things like colds and coughs, flu, allergy, and so forth. But what we found was that AI makes primary care accessible to those who also may be isolated by distance or weather or have the transportation issues. And this includes then all generations. So we were pleasantly surprised by how quickly it's been adopted by our full-time residents in the community, including seniors, for other purposes like women's health issues and dermatology.
And that is very encouraging. So tell us then, how does it work?
Well, we use a smart exam from Bright MD. And Winona Health then gives clinicians rapid access to real-time data that's populated by the patient and linked to their medical record. This smart exam tool is a digital platform on our website that's available 24 hours a day through our urgent care providers. And it works like this. So patients will answer an AI-enabled online questionnaire about their current symptoms, medications, and health history, as well as choose their preferred pharmacy. It takes about 15 to 20 minutes to complete the medical interview. And we refer to this as retail medicine. So individuals can create an account and log in on the Winona Health website at winonahealth.org/smartexam.
So Rachelle, then what happens with the data that's been collected in the questionnaire?
So once the patient has completed the questionnaire, it is immediately sent over to be picked up and reviewed by a healthcare provider online at Winona Health. And our providers provide a diagnosis and a treatment plan. Responses then are provided weekdays from 7 a.m. to 7:30 p.m. and then on weekends from 8 a.m. to 4:30 p.m. This completed visit then goes directly into the patient's medical record, which is integrated with our Winona Health Cerner platform. The patient will also receive an electronic summary of their visit. Our doctors can treat these patients in under 2 to 3 minutes without touching the electronic health record, and then they can forward prescriptions to the patient's preferred pharmacy if that's needed. So the total process from the patient's start of the exam to the completion and the script being sent to the pharmacy is about 25 minutes or less. And this will include the time between the exam being sent and the provider picking it up to review and complete, and then closing the loop with the notification back to the patient.
That's really an efficient process. How have your clinicians responded to the program?
Well, initially they were a bit skeptical until they actually sat down and worked with it, and today they're very supportive. We have 13 providers that are performing smart exams. 4 of them are physicians, and then we have 9 nurse practitioners or PAs. And approximately 1,000 people have registered online to date. So our providers conduct between 45 and 60 exams per month right now. And it's picking up a little bit more now with the flu season in effect, and they're working to further grow this particular care option over time. They also like this because the smart exam and the clinical care involved in this is evidence-based. So our physicians at Winona bought into this new service relatively quickly, and now they're very vested into its success.
So it's really a very productive way of treating and accessing patients, to the point where I wonder, is it overwhelming? How you're looking at growing it over time, but you're conducting 40 to 60 exams per month right now. Do you have the capacity to handle this volume?
Well, one of the really great things about the smart exam or these virtual visits is that it was integrated right into the workflows of our current provider base. So we did not have to add any additional resources. They are able to just be pinged when there is an online visit ready to go, and in between other patients, because it takes only a couple minutes, they're able to respond to that patient very quickly.
That's really impressive. So now, Rachelle, how do you bill for the treatment using Smart Exam?
So here at Winona Health, a Smart Exam virtual visit costs $39 in cash, and it can be paid for online via a credit card, a debit card, or an HSA card, for example. And if no diagnosis is made, then there's no charge for the smart exam. Additionally, if the patient's condition is more serious and it requires an in-person visit, they're referred for that in-person appointment with another healthcare provider, and they're not charged for that smart exam visit.
So, Rachelle, you've been involved in this about 8-9 months now. What have you learned from the experience to date?
Well, for us, I think we found that offering this level of care and convenience online allows us as an organization to overcome some of the obstacles that were in front of patients when they were deciding whether or not they should even get healthcare services. Things like taking time off from work, the need for child care and transportation, or even just anxiety about in-person appointments. The Smart Exam has really helped us break down some of those barriers and provide greater convenience on demand for patients. This Smart Exam was implemented at Winona Health to help us tackle issues of cost and access to care, which we hear about frequently from our community and from patients. And in fact, it has helped us address both of those issues. As we were just discussing, one of the best aspects of the Smart Exam was its efficient use of our providers and our staff. We did not have to add any additional resources in order to provide an additional service to patients in our community. Additionally, by freeing up through the Smart Exam, the time of our full-time employees, they've been able to focus on the more complex patients who are coming in through our urgent care, our clinics, or emergency department.
So it's really been a wonderful success. When you review this, you're talking about 13 providers, over 1,000 people registered, conducting 45 to 60 exams per month, and you're looking at growing. So then what's next for artificial intelligence at Winona Health?
So as I indicated, currently the Smart Exam is linked through our hospital-based urgent care center, and we're going to be expanding that to some additional clinic locations in early spring of 2020. One of the other really nice things about the Smart Exam is that it has a mental health module, and we really want to focus on that and promote it more robustly across the community, because that will actually support a community need that was identified in our community health needs assessment.
So it's cool that the Community Health Needs Assessment is a living, vital, strategic planning document as well.
Yes, it has been.
That's excellent. As noted in the AHA Rural Report, insufficient access to primary care leads to poorer health outcomes. Plus, isolation and limited transportation options in rural areas aggravate access challenges, which contribute to delayed or foregone medical attention and even disease progression. AI-enabled technology that partners with doctors, nurses, and other clinicians improves diagnostic and treatment decisions and expands care when obstacles impede access. Well, thanks for listening, and thanks to Rachelle Schultz, CEO of Winona Health, for sharing her experience with artificial intelligence and the Smart Exam platform, and to Talia Schmidt and Jordan Sarver for writing and production. And if you want to learn more about the work that the AHA is doing to improve access to care in rural communities, visit us at www.aha.org. I'm John Supplitt, and this has been Advancing Health, a podcast brought to you by the American Hospital Association and its Center for Rural Health Services.